Hello.
Hello, you four. Oh, you're a motley crew. Hello, pups. Hello.
Hi, baby.
Hello, you.
So they were all found together.
Right.
They were found in a lady's garden.
Hello, you.
And my first impressions are these dogs are clearly neglected.
They're just in an awful way.
They're all quite thin, but what really strikes me is that they've all got skin problems and there's masses of hair lost.
They all look horrific, don't they? Their fur is in patches and tatty or even non-existent. I'm a little bit worried about this little Pom though. I do think we need to have a little look at her and see what's going on.
Hey, come on.
Hello. Hello, everyone.
It was very clear from the get-go that the Pomeranian was the one that was struggling the most.
Hello, you. Can I see you?
She's the one that's lost the most amount of fur. She looks in the worst condition. She's very thin. She's struggling.
I can see, well, clearly the biggest problem here is her skin and the complete lack of hair. So this has been going on for a while. She's lost a huge amount of fur as a result. Who would let their dog turn into this?
Get into
I mean,
this
it's
state.
disgusting.
It really shocks me to the core, and to see a Pomeranian look like that, I just don't know how the people here do it, and I don't know how their hearts don't break every day.
She's also coming pregnant.
Oh, you're joking.
So, yeah.
And what happened to the puppy?
The puppy didn't survive. The puppy wasn't even a proper pup, so it wasn't even fully formed. And so,
Sickening,
yeah.
isn't it? Really upsets you, doesn't it, to see this?
It's heartbreaking. Everyone gets upset. You can't help it. You wouldn't be human if you didn't get upset about something like that. Sorry.
You're okay, we're going to sort you out. Hey, don't we? We'll sort you out. Hey. It's all right. Oh, hello. Hello.
Hey!
Wow, they're affectionate little ones, aren't they? It's incredible, isn't it, for four dogs that have suffered so badly. They're very sweet and kind-natured.
And still trusting.
All right, well, what I think we need to do is, all these guys look like their conditions are quite manageable, but this little one clearly needs my help.
You sort of really wonder how and why this happens.
Just so patchy, aren't you, sweetie? Gosh, look at that. Just non-existent coat, eh? There's more skin than coat there, isn't there? There's little bandy legs are shown off by the fact you've got no fur on them, so you can see the amount of fur that she should have in this patch there.
Is this new fur that's coming through, do you think?
Could well be. I mean, it depends what the cause of the hair loss is.
Will she get her fur back?
I don't think she's lost fur for no reason. I'm pretty sure we're going to find a reason here. And I think that reason could be anything from mange mites to hormonal conditions.
Right.
So I think what we need to do is take it to the practice and then just get to grips with what exactly is going on.
So you're going to go with Scott, he's going to take care of you, and you're going to come back, well, you're going to find your referrer home, and you're going to be his stunner. Just going to be a beautiful little girl.
Yeah. You are so
little
lovely.
nest.
What are we going to call this little lady? What do you think?
I don't know, she's very tiny, she's so petite.
Yeah,
She's going to be beautiful.
I reckon. Yeah. What are you
Maybe
thinking?
we could call her Kylie?
Kylie. Ooh, nice Aussie name. I like
Yeah.
it. Yeah.
I thought you might like that one.
I do. No, well, who can't like Kylie? Hey. Oh, gee
Yeah.
whiz. You wish you'd be as good looking as Kylie.
Yeah.
Hey. Well, let's see what
It's
I can do.
something to aspire to, isn't it?
It is. I'm not a miracle worker, but I'll try my best. Hey, Kylie, I like
I think
it.
she's got potential.
It's a hell of a namesake. Eh? It's a lot to live up
Aw, well, she is so tiny, and she's just, well, she's petite, isn't she?
to. She is. She is.
She should have a lovely little pretty name, and
Yeah. You've certainly got a perfect personality, eh?
hasn't she?
Yeah.
Sweetest little girl.
All right then, cutie. Hey, your little trip to Richmond?
She's really stolen my heart, this little one.
She has. Say goodbye to Sonia.
Bye-bye, darling. We all get quite attached to the dogs down here. We might only spend a few days with them, but we love them all, as if they're our own, really. Okay.
I never understand how people can be cruel to animals. They're defenseless, innocent creatures. Why would you be mean to them? Why would you hurt them or neglect them? I just don't get it.
Take care. Bye-bye.
Aren't they beautiful? Scans everyone.
Hiya. Oh God, who's this? Wow.
I've just taken Carly back to the practice and understandably people are a little taken aback. She's a very friendly, sweet-natured dog, but wow, she makes a first impression.
What's the matter with her?
Well, it's a long list of ailments that little Carly's got going on, I'm afraid.
It's so sad. You're in good hands now, little one. Look at that little tooth.
Carly's not the only special guest that we've got at the practice today. We've also got our new vet graduate starting as well. Riaz, fresh out of vet school, he only graduated yesterday, and it'll be very interesting to see how he gets on. Hey Riaz.
Hey Scott, how you doing, mate?
I'm good, mate. How are you?
Good to see you again.
Congrats
How's
on the
everything?
graduation.
Oh, cheers, pal.
How'd it go?
Oh, mate, it was amazing.
Yeah?
5 years, finally there.
So, and here's our consult room. Ah, and it's Emma.
Hello.
This is our head nurse,
Hi,
Emma.
Hi,
Riaz, nice to meet you.
Riaz,
How you
new
doing?
grad, fresh off the press.
How fresh are we talking?
Oh, too fresh.
Yeah, as in like a day fresh.
Oh.
Yeah.
Like yesterday.
I'm glad the first person you met at the practice is our head nurse, because I would say as a new grad, the person that you want to be besties with is definitely the head nurse.
So, head vet, but you call the shots.
Yes.
Pretty much.
Yes, I do.
Yeah.
I'm glad we've established this hierarchy on day one. Get it right from the offset.
From the very beginning. So,
Brilliant.
you, Scrubs, you downstairs, and I'll bring the dog. I thought today that Carly would really help to flex Riaz's veterinary muscles. So guys, meet Kylie.
Oh my God.
A baptism of fire to try and understand everything that's going wrong with this dog and what we can do to help her.
This poor thing, what happened to her?
Hi, sweetheart.
Well,
Gorgeous.
we have virtually no history on this dog whatsoever, so we have to piece it together ourselves. So you're going to do a full exam for me, tell me all the issues that you find, and how best we're going to treat them.
Right, well let's get started then. Look how much hair she's lost. You can see right through to her skin and you shouldn't really be able to do that at all.
When Scott told me there was no history, it was literally like a nightmare. I was like, oh, can't I just have an easy vaccination or something to do? But I'm happy to do that, so bring it on.
We're going to start at the front of you, little girl, and work our way back, eh? Yeah, a little look inside. Oh, darling, you're missing quite a few teeth as well, aren't you? That's quite big. Oh, skin's quite darker as well in patches. She must be really itchy. This is clearly something that's just, not happened overnight. Checking these ears of yours. Oh, you've been scratching these ears a little bit, have you? A glamorous job of smelling dogs' ears as well.
I was about to say, is this a diagnostic tool they teach you in veterinary school?
It's one I picked up myself.
Nice. Nice.
It's actually something I enjoy. Just have a quick little listen to her. Good girl. Okay, that sounds fine on that side. My professor at university would be very annoyed if I didn't listen from both sides. I hope he's watching.
No, I've never seen anything like Kylie. I think she's the first and hopefully the last time I ever see anything like that.
I mean, just looking at her tummy and her mammary glands here, she's clearly had puppies.
Well, you'll be horrified to know that just 2 days ago she had a stillbirth at the kennels.
She didn't, okay.
Yeah,
Wow.
everything you've been through. Yeah.
It's not fair, is it? When I heard that she'd lost a puppy, I lost it myself. I broke down. I don't know if it's a maternal feeling, woman to woman, but the thought of losing your baby in a stillbirth, it just made me feel for her. It's just not fair.
So, Dr. Riaz, what do you think?
I think what we should find out first is the skin problem, whether it is a simple skin problem, whether it's just a parasite or something like that, or there's an underlying cause perhaps. I think we should start with some skin scrapes.
Good, you've done this before?
Yes, in training.
Scraping the skin with a scalpel blade, it's not nice. But what we're trying to do is to try and pick up any evidence of mites. Lovely, that's great, good work. Good job. Good girl, honey. There's a couple of different types of mites that could potentially cause the amount of hair loss that we've seen in Kylie. And then we look under a microscope and see if we can see any of these little things. Where are you little blighters? They're gonna be in here somewhere. So guys, no mites found on this microscope slide. So what are we gonna think about that?
The fact that we haven't found it doesn't rule it out. So I think what we should do in the meantime is start treating for the mites and perhaps run an additional test to confirm the presence of it, something like a blood test.
Sounds good. It seems to us that the biggest likelihood is that Kylie is suffering with mange, and the best way to kill off a mange mite is by giving the dog a bath and start helping Kylie to recover and grow that fur back. Now you've got to give a dog a bath. A very technical job.
I'm very qualified for it, let's do it.
Riaz has done extremely well working up this patient. He has good understanding of the types of conditions that could lead to this poor little dog's problems, and then the best way to treat it.
We don't know yet if we're treating for which type of mange, so we're just gonna hit it hard. So we're just gonna not get her face too much. This bath is not the nicest thing. We're dressed up in masks and gloves because it's pretty strong stuff, and poor girl has just stood there taking it. So what we'll do with the rest of it is just sponge it on a little bit.
You get free tummy rubs. Hey? Hey, gorgeous. So I think the important thing with this is that we just get a good coverage. The way this works is it will kill the bugs from the outside and hopefully make her feel a lot less itchy, and she can start to grow some of this hair back.
Absolutely. I can't wait to see her full of hair again.
I know.
If it is just some bugs on the surface, then we should start seeing some progress in the next few weeks with regards to her hair coming back.
I never thought that I'd get such an interesting and a bit bizarre case as I have today.
And with me, your first nurse.
That's true. How does it feel to take... No, I can't say that.
Your nursing virginity. I can't wait to see her full of hair again. I bet she's gorgeous. I challenged the mites to survive the white stuff. All right, lovely. I think we've doused you and bathed you enough.
We're still awaiting the results of the tests to see if there are any underlying conditions, but at this moment in time, I'm quite optimistic for Kylie.
Bless her. Normally dogs take so long to dry, but she's got no hair, so she's dry already.
Look at her.
Say thanks, Riaz. Thanks for day one.
Bye, gorgeous. You're
Go
going to
on,
sleep well,
sweetheart.
aren't you?
She's a little bit quirky looking at the minute, God love her, but everyone has just fallen in love with her. She's got the most expressive little face, and her little tail, bald as it may be, doesn't stop wagging, and she's just stolen everyone's hearts, I think, today. Well, you'll feel better soon, I promise.
You'll never forget your first sort of patient, regardless of what it is. I think I'll remember Kylie forever.
All right, honey. Get you some dinner. Shall I get you some dinner? Kylie!
Well done! Look at you, well done.
Hello, Sonia.
Scott?
Oh my God, Kylie! How are you?
I'm good.
You look incredible.
Doesn't she?
She's an absolute vision, isn't she?
She looks fantastic. Did you recognise her?
Hardly. Well, first of all, she's got hair. It's incredible.
We were really concerned about Kylie. She was covered in fleas. Her skin was so bad. She was so undernourished, so underweight.
Who would let their dog turn into this?
Get into
I mean,
this
it's
state.
disgusting.
She was quite a poorly little dog, and she's just come a really long way. Kylie is just loving the attention, and she deserves it. So I say, go Kylie.
Hair
She's
on
like,
the face.
look at me, look at me. Her legs.
Hair on the legs. Hair on the tail. Look at that. Kylie looks absolutely amazing. I can't believe this is the same dog. She looks beautiful. You look amazing. Wow.
She is a princess.
Oh, you are. Let
you
me
go.
have a
Who's
look
that?
at you. Hello, beautiful. How are you? Mwah.
Remember Scott?
I think what the irony is here is that she had fox mange, and now she looks like a
And
fox.
you look like a fox.
Don't you?
You're like little Foxy,
Hey?
Foxy Kylie. I hope that she's just going to be as happy as she is and have a lovely life with people that will love her and look after her, give her the love that she deserves. We adore her. I think Scott's fallen in love with her as well, so.
Beautiful foxy Kylie. Good girl. I'm driving out today to see Andy and Keely, who run the Mayfield Alpacas Animal Park. And recently they asked me to pop up to help with their Randy meerkat, Nguvu. Now this time it's not meerkats or alpacas even that are causing the problems, but a creature much more associated with Christmas. So I just hope that I can help.
Good boy.
Come on, Elsa. Come on, Svenny. Come on, good boy. There you go. Good lad.
Hi guys.
Hiya.
How you doing? Hey Keely, good to see you.
Yeah, you too.
Hey Andy, good to see you again. Merry Christmas.
Merry Christmas.
So, you've dragged me all the way back up to Yorkshire for reindeer. It's Christmas.
Yep.
Preparations need to be made. So tell me exactly what I'm doing today.
This is Sven, so he's our male reindeer. And then we've got Elsa over there. But it's Sven that I really want you to look at today. Scott's here today to help us trim the feet of a reindeer. So our reindeer feet, they do continually grow, so sometimes they splay out and then they can crack. So Sven's feet are looking like they do need doing. He does need a Christmas pedicure because he does have to look nice and sparkling, ready for his crowd.
What an incredible festive thing to do as a vet, to trim the hooves of a reindeer.
Sven's quite feisty, so yeah, he'll have his work cut out for him.
Let's just say they've got some Christmas spirit in them. We'll say that for the minimum.
It looks like a pussycat. What are you talking about?
Yeah.
I'm sure that if elves can do it, you can do it.
If elves can do it, I can do it. There we go. Keely and Andy are playing it a bit cagey about how friendly or not the reindeer are. But look, it's Rudolph. What have I got to worry about?
She'll keep him calmer, and we'll say calmer.
Yeah. Sven and Elsa are really nice reindeers. They're Norwegian. They're coming up to 2 years old. They don't look very big, but they are very strong. Elsa is a little bit more nervous. She will come up and hand feed, but Sven has got a lot more fight in him. I think we should try you with Sven. He's the nice one, honestly. Both the reindeer have got their long lines on, so all I need you to do is go up to them, stand on the long line, and then just reel them in.
Okay.
So like a big fish.
And as an Aussie, you should be used to that.
Right, sounds
that
so easy.
makes sense.
Yeah, no,
Yeah.
it sounds
Yeah.
very easy. And your experience is as a vet nurse, is that right?
Yes, that's right.
Like every vet nurse I know, very good at direction.
Yeah, we're very good at giving instructions. So
Right.
that's what we are. Not bossy, just we know what we want.
Okay, good. Well, I'm ready to be instructed. Are you?
Yeah.
Yep.
Okay.
Always.
Right.
If you just come through this way,
Okay.
mind the rear.
Let's go. Come on. Oh, and they're off already. Oh my goodness.
Scott, I'll give you those.
Oh yeah. Thanks, mate.
Scott looks a little bit nervous,
Come on, Sven.
but Scott's a big Aussie guy. I'm sure that he can deal with the sort of power that's behind a small reindeer. It's nothing compared to a kangaroo or a great white shark, so I'm sure that, you know, that Aussie fight can come out.
So close. So close.
We usually try and step on the lead rope and then reel them in from there. Scott's method seems to be diving on the lead rope.
I was so close. Honestly, I had it.
Not a method that we usually use and not one I've seen before. It's comedy for us, we quite enjoy watching it.
It is way harder than I thought it was going to be. I honestly thought that it would be a really gentle walk along, hold the rope, draw them in, give them a carrot. But no, these reindeer are fast. He's got her.
Well done.
Show off.
I had mine. Hadda gloated a little bit too much, got a little bit too enthusiastic, and her lead rope snapped the actual head collar and she got away.
Yeah, see, that's what happens when you show off.
Definitely the reindeers are winning.
Yeah, that made me laugh. Okay, no, I'm not giving up now.
Just a warning, they can jump 6 foot as well.
Oh my God.
Scott's definitely getting a bit hot and sweaty and a little bit frustrated, I should think. He doesn't look like he's going to give up though.
Come on, Sven. Crap, are you kidding?
Oh gosh. We have contact. Not quite as
So
quick as a
close.
reindeer.
I was so close. Oh my God.
He doesn't look like he's going to give up though.
Got him.
Keep hold, keep hold, keep hold, keep hold. Reel him in.
Come on, mate. Oh, man. Come on, Sven. Come on.
Keep nice and calm with him
Good
and just
boy.
be careful as you get him close to you.
Good boy.
The reindeers, they use their feet to kick and they also use their antlers to headbutt you as well.
Come on, Sven. Come on now, buddy.
Yeah, try and hold as close up to the head collar as possible and then keep to the side of him. Just
Okay,
in
so
case
actually
you
try and grab his head collar.
just underneath you where the buckle is,
Okay.
and then you should be able to start walking
Okay,
him.
Sven.
That's it.
Good boy. Good boy.
Perfect. And then so you're at the side of him, both hands on the lead rope.
Okay. Okay. Good boy. There
Yeah.
we go. Let's be friends.
That's it, isn't it?
Good boy. Oh, yeah. Come on. Go.
I think the adrenaline's pumping in Scott. He is doing a good job. He's doing the right movements. He's talking to the reindeer.
Come on. Come on. Let's behave nicely now. Come on.
I think the competition's on now to see who can hold on to who.
Whoa. Come on. Wait. Hey. Calm down. Come on.
Even though it does look a bit of a stressful experience, probably for all involved, not just the reindeer, it's something necessary they need doing. So as the feet do get longer and they do become splayed and cracked, that can cause infection and pain as well. So we try and do it as quickly and efficiently as possible, even if it does look a bit manic.
Come on. Come on. Sandra's waiting.
Honestly, it is like trying to dance with a big, massive reindeer. He keeps spinning me round and round in circles. He's bucking.
Come on, lad.
Not much further.
It's an absolute nightmare.
It'll just be a bit of a dance on the way up there.
Yeah. What kind of
You're
dance
not too
is it?
dizzy, are you?
Come on.
It's funny to watch someone else going through that. Usually I'm the cannon fodder, but it's all practice. At least he'll have a good dancing skill at the end of it.
I'm not thinking it's ballroom, or if it is, it's really bad. Now I know how Santa feels. It's so exhausting.
Nearly there.
Come on, mate.
We're nearly at the barn, and honestly, I can't wait to let go of the halter.
Wait. Come. Oh, okay. All right. Do you want to back in? Hey? Can you reverse park? Hey? Whoa!
Made it.
I'm absolutely exhilarated to get to the point where we've finally been able to release him and let the big guy go. Was such a relief.
You all right?
I've been reindeered.
Rest time.
Oh, that's so exhausting. How do you do that every Christmas? That is ridiculous.
So we've got him up to the barn, so we'll leave him in the stable for a while, for at least an hour or so, just so he can chill out, have something to eat, and he's not too stressed. If we went in there straight away to try and do his feet, I don't think he'd allow it, because it's been a bit of an experience getting him into the barn. So now we just need to let him be for a while. It'll be worth it, Sven. Sort your feet out. Good boy.
Well, I think that's overstating it. Good boy indeed.
Reindeers are feisty, plucky, very powerful creatures. And yes, they're absolutely beautiful and a massive part of Christmas, but wow.
I can understand why Santa gets so exhausted on Christmas Day. It's not the presents, it's the reindeer. After that, is Sven going to be on the naughty list? Possibly. He's a beautiful reindeer, but I think we need to spend some time apart.
Right, see if he's a bit more relaxed about everything now.
Let's hope so. I am after that break, I can tell you.
Yeah.
Hello, mate.
He actually looks a lot happier.
He does, much calmer,
Yeah.
breathing much more slowly and relaxed. That's good. Pedicure of a reindeer. I'm getting nervous again.
He looks quite happy now.
But I've learnt my lesson from last time. So what's the plan, boss?
What we'll do is send Andy in, if you're happy doing that.
Thanks.
Send
Lucky
just one
boy.
of us in, yeah. So if Andy can go in and pin him against the wall, then I'll get another member of staff to hold on to him as well, so there's two of them. And then we can get going trimming feet. We'll just try and do it without sedation first.
Yeah, I think that would be
best
nice.
for him.
Yeah, quite a risky thing to use at
Yeah.
the best of times. So let's try and see if we can do it without drugs, shall we, mate?
Sedating reindeers can be a bit of a problem just because they seem to not need to take as much for the sedative to take effect. So we've got to be really careful not to overdose them. I am sending Andy in first.
Right, fella. Shh, shh, shh. I know.
He does seem to like to go in there and get involved.
This could potentially be quite a dangerous situation. Steady, steady. So, as always, I'm used as cannon fodder. I know. We've got not only antlers, you've also got the ability for the animals to kick, not from just from the front, but from the back, and they're not like other animals. They can kick to the side, they can jump and actively go for your face. It's definitely a hard task ahead. Luckily, Scott's on hand in order to try and sedate him if we need it, but if we can do it without, that would be much better for the welfare of the animal. Just squash it back in. There you go.
Right, going in.
That's actually a really good position.
So I'm at the front pinning Sven at the minute, and we've got Nick at the back. And at this point, all I'm concerned with is keeping the head down. Nick will keep his back end down, and we should be safe.
How you going there, Nick?
Fine. I'm looking for any sudden movements. If the animal feels that you are relaxed in any way, shape or form, he'll take advantage of that and he'll jump up.
What's so incredible, Keely, straight away I see is he's got 4 toes.
Yeah, so they were like snowshoes then.
Yeah, so what, they sort of splay out on the snow?
Yeah.
Amazing.
Really good job.
Huge.
So this joint here clicks. And that click is a communication. People seem to think it's something wrong with the joints, but it's not. It's a communication between reindeer. In the dark, if they can hear that click, and that click means there's another reindeer there, so it's safe, not a predator.
Because so many people would think that it's just the hooves hitting the ground, but it's not. It's actually the ligaments in the joints.
Oh, they think they've got a joint problem, and they haven't. That's normal for a reindeer.
Wow.
If you heard it on a dog or a cat or a llama or an alpaca, you'd think that was something strange, but...
Learn something new every day. All right, so how much of this, I can feel it's very thin there. Reindeers in their natural environment will wear down their feet by walking on rocky surfaces. Here we go, mate. When they're in a paddock, of course, the hooves are going to continue to grow, and that's why they need trimming. It is dead keratin, so it's not going to hurt, eh? Okay, mate. Happy with that?
Yeah.
All right. Okay. Nice. Although what I'm concerned about now is I've sharpened it up quite a lot for next time.
It's got points.
Yeah, it's got points.
So things are going really well at the moment. The feet are being clipped without too much problems. Sven is actually behaving himself. He's been really calm, he's been really still, a lot better than I thought he would be. I don't want to jinx anything at the moment, but he's looking really good. Yeah, we weren't expecting him to be this good, were we? Not at all.
I know.
Yeah, reindeer whispering's paying off, I think.
Do you think?
Yeah.
Being dragged around a field by a reindeer. If that class is whispering, then I'm very good at it. Okay, so Keely, how's my first?
Hey, that's good.
Pedicure on a
That is
reindeer.
good, yeah. Look at that. Nice and smooth around, a lot shorter.
Wow.
Compare it with underneath.
Maybe I've missed my vocation. Reindeer nail clipping. Nails by Dr. Scott. Available only at Christmas. All right, so that's one side of our deer done.
Scott's very good with Sven. I think they've had some reindeer whispering. They've done really well after the little bit of a to-do in the field. He seems to have got control of him, shown him who's boss. So it's going really well.
Ready?
Yep. Just get to his leg.
Try and
there.
get to a foot again.
Good boy. Amazing. All right, let's get that extra toenail off you, mate. Good
Don't let him
boy.
fool you though.
No. Good boy. Final foot, then we'll get you back to your girlfriend Elsa, hey? Yeah. Come on. It's been really interesting to get to know reindeer today. I didn't know that they were as strong, as powerful, as feisty, but now I totally understand why Father Christmas chooses them to pull his sleigh. Okay, last one, and we're done. I'm not convinced that I've got a friend for life with Sven. I think we have a healthy respect for each other, but I don't know if we're going to be great mates in the future. I love Christmas, so hopefully he'll take that into account. Right, there we go. One completed reindeer pedicure. I'm pretty happy with that.
Yeah,
That's
really
perfect.
good.
Yeah.
I think Sven's going to have a really good Christmas now. His toenails, they look really nice. He'll be ready to step out at Christmas, greet his crowds.
Good luck, Sven. Hey, I hope that Elsa's impressed with your new footwork. And have a good Christmas. I'm very worried about seeing this bull. I'm sure he's an absolute giant.
Bulls can be a bit aggressive, they can be dangerous, so I think we've got to be careful in this situation.
Oh, great. It's tiny.
Bull, there he is.
I was expecting something this high.
You'll grow into a big bull eventually. He's only a baby. Let's go down, let's have a look at him, Scott.
Hello, boys.
If you look carefully, you'll see he's got a tremendous hindquarters. He's really well built. And so that's why they feel he has potential as a bull.
So what you're saying is that he's got a bigger bum than the other one. And from a beef cattle perspective, he's going to pass it on to any offspring that he has, which is also
That's right,
very
yes,
positive.
and produce very good beef calves as well.
Dave and I commenced the examination of this bull from head to toe to make sure he's up to scratch and he's going to be a good dad to all of the Roberts family's new calves.
He's got a lovely temperament.
Yeah, I can tell. Yeah, he's
Good boy. He's just very strong. He's a very strong animal. But otherwise, he's lovely and quiet. You can handle him quite nicely. We'll just check his teeth, see what his teeth look like in his mouth.
Yeah.
Good alignment of the teeth with the upper jaw. Would you like to have a turn and examine him? Have a look at him?
Yeah, sure. This bull is maybe not as big as I expected, but it's certainly bigger than all the patients that I treat in Richmond. Good boy. Are they like dogs and cats? Do they respond to being talked to?
Yes.
Yeah,
Yes,
definitely.
they do.
Definitely.
Oh, well, there you go.
They know your voice.
Oh, hello. You probably haven't heard my accent before around these parts, I wouldn't have thought. Hey, g'day, mate. How's it going? Hey? Hey, you're a handsome fellow. Nice, incredible. Incredible to look at these beautiful brown eyes close up. Very nice.
Right, let's check his height.
Yeah. Good boy. Good boy. My initial impression is that it's running faster than I thought it was going to be.
But just same with dogs and cats, the younger they are, the faster the heartbeat.
Yeah. His eyes seem good, his heart seems good, everything else is looking very, very good. But at some point, I know I'm going to have to go to the business end. All right, Mel, and I promise to be gentle.
If the bull hasn't got good testicles, then he won't be able to work as a breeding bull. Getting nice and close to him. Okay, grab both testicles. Get a nice firm grip there, Scott. Well, Scott's definitely got his hands full, but he's got great technique. Feeling good?
They're very firm. They're very impressive. I feel myself blushing. It's a nightmare.
Well, in the bull, he likes his scratches and he likes to be with people. Obviously, they're bonding.
Good, just check them for symmetry and size. Check for any lumps and bumps. And they're of a good size for his age. Everything feels great.
They do feel great. Ladies, I think that your bull, hopefully, he's got the equipment suitable. He's ready to go. I think the Roberts family are going to be very happy to know that their bull's up to the job. I'm just not quite sure that I am. Okay, big guy. There you go. Good boys. Farm stuff's hard work. It's been such a long time since I've been at a dairy farm. It's been 17 years, so a long time, and I'm actually really looking forward to it. All right.
Ready to crack on?
Yeah, absolutely. David obviously is the lead vet here. He's the man that knows what he's doing, and I'm the humble pupil.
Yeah, I've got one for you as well, Scott. We'll get the scanner out for you now on the front there. Just put this on, put the headset piece on.
Wow. Quite a bit of kit, isn't it?
Yeah, we're all spaced out now.
Yeah. It's a very interesting kit. It looks straight out of Star Trek kit. It's basically just an ultrasound. The same thing that we would use in our clinics back in Richmond, but this is designed for internal use. And I'm not very much looking forward to where I'm going to have to put it.
Have you got an image?
Oh, wow, yeah. Cool. Yeah,
Good.
so that's the ultrasound scanned image I can see right in front of me.
That's right, yes. Okay, let's go.
I'm actually feeling surprisingly nervous, way more nervous than I ever expected that I would. I'm an experienced vet, but not experienced when it comes to large animals. So I feel like I'm almost going back to school. Morning, girls. How you doing? I just hope I'm up to the challenge. All right, so here's the first lot of patience for the day. Here you go, good girl. Hello, ladies. I promise to be gentle. It's really important that every cow on the farm gets pregnant every year. If they produce a calf, then afterwards they can produce milk. It's just like when you're a mum, you only produce breast milk once you've had a baby, and the same applies in cows.
I'm just going to scan the first few cows.
Yep.
And if you just watch to see what I'm doing, and then later on you can have a turn, have a go, right?
All right.
So we're going to use the scanner to see if they're in calf. Just put that probe in it.
Most of the time, these girls have a lovely time eating grass in the beautiful Welsh fields. And the farmers, of course, keep very close tabs on them, but every now and again, they do have to get them in and do medical procedures on them. It has to be done, but hopefully we'll be as gentle and as kind as possible.
Again. So mark with chalk. With a block of blue when she's in calf. So you know, all the blue cows are in calf.
I've got a nice blue tail.
That's right, nice blue mark on the back.
Okay, next.
So you got to watch them because they will barge on.
Okay. I'm like a cow bouncer.
That's right. You're doing a great job there.
Thank you very much.
I know that Scott will find it a challenge. And just putting his arm into the cow, it's a whole foreign environment. And I think he's really got his work cut out today. I've scanned it, I've checked it. So we'll now give you a go and see what you can find in the cow.
Okay.
So, you all ready?
Yes.
Is the scanner turned on?
It's definitely on, so at least the equipment's right. I can't blame the equipment.
Okay, good. Let's see how it goes.
It's been such a long time that I've worked with cows, and so I really want to make sure that I don't embarrass myself too much. I'm totally put off by the sound effect she's giving me there. That's pretty impressive.
Go on, get on with it, and we'll see what you find.
Okay, I'm going in. So, oh man. That's an experience I haven't had in 17 years. That is, oh man.
I'll be quite happy if Scott can just find the womb initially.
Is it in the top left-hand corner of the screen? Would it be there?
If he finds a pregnancy, I'll be really pleased.
What can I see here? Okay, I'm trying to find her uterus.
Just scan left and right, move the probe over the womb, just left and right.
It's absolutely amazing to be able to use an ultrasound like this in the field. Oh, wait a minute. What's that?
I can tell from Scott's expression how he's getting on. And initially I can see he's really concentrating, he's focusing on what he's doing. And then eventually you can see his eyes light up.
Oh.
And you think, wow, that's the eureka moment. He's seen something wonderful, great, fantastic.
Okay, teacher, please tell me, I'm pretty sure this girl's in calf.
Yes, she is in calf. Well done, Scott.
Oh, thank God.
She's in calf, she can go. And then, of course, you have to move on to the next cow, and the next, and the next, and you have to do it all over again. But so far, he's doing great. We'll make a farm bit of you yet, Scott. Welcome to Wales.
Oh, mate. This is an incredible experience. It's so out of my comfort zone, but also really exciting and interesting and different. I've just got poo on my lens. I've had a poo accident. That's nasty. And I'm covered in poo. How can I wipe that off? Philip mentions about the fact that there's a foal hernia. Now, I haven't done horse surgery since university, so I'm incredibly nervous. I hope I can help, and I hope that Philip has faith in me. Hello.
We're going to send you up the paddock, pick up the foal, and Kim and I are going to start setting up in the barn.
Okay, I'll get the foal, you get prepped.
That's right.
Sounds good. All right, see you in a bit.
Right on, okay now. Normally I do these things on my own, so it'll be quite novel to have an extra pair of hands there.
You don't know what you're in for, do you? That's my coat you got hold of. Don't pull me over. Don't pull me off. It's naughty. Let go. You haven't brought him up with very good manners, have you? You have him, Misty. I spent a whole lifetime with horses. I don't think I would want to live without the horses. They mean everything to us.
Hi there, Di. How are you?
I'm very well,
Lovely
thank you.
to meet
Getting
you.
a bit wet, but there we are.
A little bit wet, a little bit windy, but there we are. We're in Wales,
we can't
in a
help
field.
It, can we?
Very brave boy. You going to be a brave chap? Hey? Yeah, you can see so clearly that hernia. It's a decent-sized one, isn't it?
It's nasty, isn't it?
An umbilical hernia is basically a hole in the abdominal wall where the muscles haven't closed after birth. And what happens in Freddie's case is that the abdominal contents will leak out through the hole and lead to a bulge under the skin. I promise I'll look after your boy. I will.
We've all made that promise to her, haven't we, girl?
Okay. Come on, Freddie. It's all about you, mate. The real danger in Freddie's case is that his intestines can pop through that hole and then their blood supply is affected, and literally Di can walk out into the field one morning and find Freddie dead. So it's crucial that we perform this surgery today. Good, Misty. Good boy, Freddie. Good lad.
Misty's there, so it's comfort for him. Once he's under anaesthetic, he won't know what's going on. But all the time Mum's there. If you take Misty out, well, then he can get upset.
Come on, Freddie, good boy.
Well, any operation is a risk, isn't it? They're like children to us. You know what can happen or can't happen. You hope for the best, obviously, but there's always that element of doubt.
Okay, I think we've got everything else here, so yeah, basically we're good to go.
Come on, Freddie. Guys, I've got your patient. I walk around the corner into the barn and it's a little rustic. I can't see any shiny lights. I can't see any steel. It is a shed full of hay and we need to do surgery in it. Different. So, Philip, I was going to have a quick feel before we knock.
That's right, yeah, because it's quite nice to know now exactly what we're dealing with and how big the actual opening into the abdomen is.
So I can get 2 fingers into the hole.
Okay.
Definitely bigger than the hernias that we feel on little dogs and cats back in Richmond.
Yes, I'm sure. Yeah, that's right. Scott can extrapolate what we're doing back to his own animals in his own surgery in London, and the actual techniques are the same. It's just the scale that changes.
Wow. It's like a javelin.
Bigger than what you're used to.
It goes back here.
Yeah. Good boy. Just hope I get it in the right place.
No need for that.
All right, sweetheart. No. Trying to place an IV catheter into a horse, a massive different world. Where's your blood vessel gone, mate? We did our absolute best to get it in as calmly and as safely as possible, but this is a young horse, and horses can sometimes react erratically, and vets can get injured as a result. Good boy, aren't you?
Yeah, that's in. Good job.
Phew. Gosh, and that's the easy bit.
Yeah.
That was actually really difficult. I haven't catheterized a horse since uni, which is quite a while ago.
Stick to rabbits.
Yeah, stick to rabbits, fair enough. Freddie's being such a beautiful patient, such a good boy the whole way through. But obviously the time comes when we need to give him the drugs to knock him out and perform the surgery.
Right, so I'm just going to inject the ketamine into his vein.
Okay, we'll see on the other side.
So it's really important that we're in a safe place. They're so heavy, and if they go down in the wrong way, they can catch you out, and you just need to have your wits about you, really.
Okay. Good lad.
Come to you, Scott.
Yeah. Oh, that's a good boy. Oh, what a good boy. You're right there, mate.
Stuck in the straw. Right.
Once the laughs are over, once Philip's managed to regain his footing, we have to crack on with the surgery.
So next stage now, we'll roll him onto his back. Roll him up. Okay. We just crack on and get ourselves scrubbed up and ready to go.
I've done countless umbilical hernia repairs in dogs and cats. That's bread and butter for me, but this is on a bigger scale completely, with an animal that can kick me in the head, and then I'm being watched by Philip. Quite intimidated right now.
You'll be fine. You will. Nervous now, very nervous. I'll be glad when it's all over. He's up and with his mum.
Right, now, so I'm going to click my initial incision up here. So we should be far enough away from anything dangerous. Surgically, the main risk is that we could damage the intestines as we're going in. And also when we're putting the sutures in place, there's always the risk that we could actually accidentally catch part of the intestines, and that can cause quite serious problems. Well, there we are. So we've got bowel there straight away.
That was just millimetres underneath that sac.
That's right, so we didn't want to damage that at all.
Well, that could lead to all sorts of complications, like peritonitis and even death if you nick that.
Yes, we nick that. It's just like having a burst appendix, really.
If you nick in the intestine, then the horse can get a massive infection called peritonitis, and they can die from it. It's exceptionally painful. It's an absolute nightmare. So it just shows that this procedure is actually a very serious one indeed.
And now that we're in there, the actual hole is a lot bigger than what we could feel on the outside.
That's amazing that intestine pops out so easily like that.
Yeah.
Wow, it just shows how important this surgery is.
Oh yeah, yeah. Basically a strangled hernia is where some bowel comes out and the blood supply to it is cut off. Then the animal can be brought in, and then an emergency op if you're lucky, or a dead horse in the field if you're not lucky. Right, I'm happy with that now. Okay. So I think we need a third, so if you'd like to do that.
Yep. Okay. Got you in the finger.
That is my finger, yeah.
Oh,
I'm aware of that.
That would have been instant dismissal.
Oh, this is a treat for me. I don't usually have another pair of hands in here on this job.
Happy to help.
Yeah. That's lovely. Okay, good man. I think Scott is doing very well. Although he hasn't handled horses or large animals since he left college, he's got his good surgical skills. That's it, it's gone.
Nice, neat tummy, all tight for show jumping.
That's right. Okay, Scott, take the leg.
Yep.
That's it.
Good boy, Freddie. Good lad. This can be a really dangerous time for horses because they can react erratically. They're very strong, and so he can go from being an animal that's just been fixed to an animal that's very easily broken. Come on. Mummy's just over there. Good boy.
It's almost over now, so hopefully he'll get up and be a bit wobbly, but then Mum can look after him. Everything will be all right. That's fingers crossed.
There we go. Up you get. Come on, buddy. You can do it.
There we are. Lovely.
Good boy. Freddie takes such a long time to wake up, but slowly he comes right. Look at him struggling towards Mum.
Yeah, I think he wants a feed, doesn't he?
He wants a feed.
He wants solace.
And that's an absolutely glorious moment. It's a real relief to see him up and then suckling from his mum. Absolutely beautiful. He's gone to the milk bar.
That's right.
So Di, that was quite intense. I must say I was probably
But it's over now.
as nervous though as, well, I think I possibly was more nervous than you.
Oh, I don't know. I wouldn't say that. Scott has done brilliant. And he's been nice with him, and that means a lot.
Good boy, Freddie. I must admit, I've absolutely loved it today. Di's an incredible woman. We're in a nice warm shed performing an incredible surgery on a beautiful animal with a great result. And my relief, I think, was just as much as Di's. Hopefully that's expressing his happiness at our work. Not bad, City Slicker. Good job. Hey Joe.
Hiya.
What's happening?
This is Toots I chatted to you about. So we've just done the x-ray, bladder's full of stones. Yeah, poor little man.
So just like 1 or 2 stones?
No, literally looks like sort of 30 in there, I think. So the more help, the better to get them all out, I think.
No worries. Okay, well I'll go and defarm and I'll be back in a sec. See you in a bit.
Lovely. I can feel he's a bit tender still when I feel on his bladder, so definitely that's still the area that he's sore in.
Yes.
I think what we need to do now is just take it to the next sort of stage of diagnostics, so to try and work out what's going on. And the best thing for that is going to be to do an x-ray.
Okay.
And go from there then, all right?
All right. You're going to behave yourself, are you?
There we are.
You little baby.
Brilliant. Good boy.
There's a good boy.
We've had Toots in with us today. He's a 9-year-old Bichon Frise who we've seen for recurrent urine infections. Come on then, there's a good boy. Come on, little man. Hi, Lauren. This is little Toots.
Hi, handsome.
Today we've taken an x-ray. And we've seen that his bladder's full of bladder stones. Oh my goodness.
Oh wow.
I think we can see what the problem is. So the aim really is to remove all stones or as many of them as we can. So what we're hoping to do is just go in, assess the bladder, remove the stones and flush out any of the smaller ones. I think we're ready to start.
Right, finally I'm in a uniform that I feel a bit more regular in. This is my normal job.
It's going to be quite nice having an assistant, I think.
All right, let's get those nasty stones out, shall we?
Expecting the bladder wall to be quite thickened as well if he's had the stones in there for a little while. You can just see his bladder there.
Yep.
I can feel a stone just under my finger actually.
No way. Can I have a feel? Oh wow. It is like a bag of gravel. Yeah.
Poor little boy.
Yeah.
There's the bladder.
It's very angry and inflamed, isn't it?
Yeah.
It is certainly a very irritated bladder, and it's because of the stones within. And how big were these stones looking?
They weren't looking very big, but there's quite a lot of them. So I think if we start with a small spoon, and then if we need to, we might need to get the bigger one in just to see if there's any bigger bits in.
Normally, when you remove a bladder stone, it's a nice, round, smooth rock, really. It's like a pebble.
There we are.
Wow. These ones, however, are very harsh, they're very sharp, and they're deeply embedded into Toots' bladder wall. Nasty little suckers, aren't they?
It feels like there's quite a few more in there as well, I think. They felt like they were a bit deeper down.
Wow.
Goodness me.
Look at that.
Looks like a little hedgehog, doesn't it?
It does. There you go. Didn't know they lived in bladders. Oh, you're gonna feel better with those out, mate.
Yeah.
The more we scoop, the more we find. It's incredible. They just keep coming and coming, and they're really angry, sharp-looking stones that are getting stuck into the bladder wall and really causing irritation to poor Toots.
And I think it feels like there's quite a few more in there.
Poor boy, he must have been in some discomfort with those.
You can see why it's inflamed all the bladder wall so much, can't you?
As a boy, passing those types of nasty stones, ouch. Oh, there's a whopper.
We were expecting quite a few stones, but there's more here even than I thought there might be. They seem to be never ending. 27, and I think that's 28.
28.
Yeah, goodness me. And some of these look like sort of, 5 or 6 joined together to make a big one.
That's a lot of bladder stones.
And still a few more in there, I think.
Right, so do you feel confident then that that's the last one?
Yeah, I think that's it. 2 more from that last flush, so that brings us up to 30.
Look how chuffed you are getting that right on the X-ray. Very impressive.
We removed all of the larger stones, and I think it's the biggest haul I've had from a bladder so far.
All right, let's close this boy up.
Lovely job. It's going to be a bit of a recovery because there's obviously so much swelling and inflammation on the bladder wall. It's going to take a little while for that to settle down, but he should make a full recovery. Thank you very much for your help.
Oh, more than happy to do so.
Being involved in this surgery, you might think, oh wow, it's opening up a bladder of a dog and pulling out stones. Well, for me, it was a relief. It was great to be in 4 walls and a roof, not covered in rain, not covered in poo, and doing something that I know how to do really well.
What do you think they've got for me next?
5:15, it could be anything, so I'm sure they'll have something in store. As long as you've got your wellies on, I'm sure it'll be covered.
I just had a phone call from one of the young farm vets, Vicky, and she needs my help. I have no idea what kind of animal I'm dealing with, but I'm looking forward to seeing what she's got in store. Right, Vicky, the cavalry's here.
Oh, it's got muscles.
Right.
Hope you've had your Weetabix this morning.
Okay, why?
Oh, we've got quite a big ram to deal with today.
Oh, a ram?
Yeah.
Really? Hello there. You're a funny-looking ram, aren't you? Hello. Mwah. You're handsome. Hi there, Val. I'm
Hi.
Scott.
Hi, Scott.
How you doing?
Nice to meet you.
Nice to meet you as well.
It's pretty much like Noah's Ark. There's animals everywhere. There's donkeys, there's a mule, there's little ponies, there's even a alpaca. It's amazing.
We take in animals that have been abused or neglected, and this is their forever home. People contact us when they know that there's an animal in need, because they know we'll go and get it. We just love what we do. When he came, he was just called Rammy. I didn't like the name, so I put a thing out on my Facebook page and asked for ideas, and somebody suggested Gordon. Gordon Rammy it was. I went out to the field today to check on them, and I saw he was bleeding from his horn. He obviously needs help from you guys.
So how are we going to go about catching this chap?
I think that's your job, really. Into this corner, just muscles.
Right. Right, wow, so it's very technical.
Just muscles, that's all we need today.
Okay.
I'm going to enjoy watching this, because I did it earlier. Gordon is very feisty. When I was treating him earlier, it was like buckaroo around the pen.
Okay, well, should we just get stuck into or just vault this?
I would open the gate.
Right.
It's much easier.
Sure, okay. Fair enough.
Okay.
Here we go. There we go. That was easier. Yes.
I should have not said anything and just let him fall over, but I thought it was common sense. Why climb it when you can walk through it?
Hello, Gordon. Keep that infamous temper in check.
Yeah. Good luck, guys. You're going to need it.
Okay. Come on. Whoa. Oh, my goodness. Yeah, boy. Come on, champ. This way. Oh, man. Come on. Come on. Good boy. Okay, good boy. Oh, you.
Who's winning here?
Well, it's sort of a tie at the moment.
Good.
Wow, that looks disgusting.
Yeah. I'm really close to his head. You can see there's a lot of discharge, there's maggots present. Alongside that, it really smells.
Whoa.
Wow, that goes down quite deep there.
Gosh. That is unbelievable.
Yeah, it's probably going down in towards his sinuses.
Yeah.
Fortunately, Val's found this quite soon, so it hasn't done too much damage.
It's all right, mate. Good lad. Good boy.
Right, I think we're give us a bit of a clean up and then give him some pain relief and some antibiotics.
That
Hey man,
sounds
make you
fair.
feel a bit better.
I was very, very concerned and very, very anxious whilst he was being treated.
Oh, no. No.
I'd be devastated if I lost him, because he does, literally, he means the world to me.
What do you think of those fine ingredients, Gordon Rammy? Is it going to sort you out? I reckon. Here we go. All right, be brave, mate.
And we want to try and dry up all the infection that's there, get that growth to shrink back and then try and seal off those holes so nothing can go back down into there.
It's all right, mate. Good boy, brave boy.
Scott really does have a great affinity with animals, and I've never seen that with Gordon, especially with somebody he hasn't met before.
Oh, sorry, boy. As you can
Little
tell.
shower there.
That connects down into his nose on this side.
Certainly does.
So,
Got a nice
water
snot
under-
shower there.
Yeah. Nice and spray. This is just some antibiotic spray to help with any infection. And then...
Hopefully that's your
this one.
colour.
Nice silver. Helps with healing.
Looks great.
Yeah.
So antibiotic injection and then pain relief.
Yeah. You ready? Both of you?
I think
Right.
so.
This one is in...
Take it like a man.
Yeah.
Come on. Good boy.
There we are.
Good boy. Brave boy.
There we are.
How'd you go? Well done.
Good man.
Good
That
boy.
should make him feel a lot better. I was a bit dubious when I rang Scott as to whether his muscle factor would be advantageous for me.
Hopefully in about an hour or two, mate, you're going to feel much better.
But I think his allure to the animals was probably more than the muscles, to be honest. And I think his sweet whisperings in Gordon's ear helped.
Hopefully those drugs will start kicking in, you'll feel better. Back to your feisty self, eh? It was really great to be involved. It was great to see Vicky at work. Good boy, Gordo. Good lad. And great to meet the wonderful Val. What an amazing woman. Ah, he was a perfect gentleman in the end, wasn't he? Just like Gordon Ramsay, obsessed with food.
I'm back to pick Toots up after his operation. So, big smile on the face today.
Oh, are you feeling better? Hey? Are you feeling better? Oh, good boy. Should we go and see your mum? Hey, who's this then? Ah, who's this?
Oh, hello, Bleepy.
Pleased to see you, I think.
Oh, little man.
Oh, good boy.
Dear me. Oh, dear me. Oh. You don't know how happy I am. No, it's a really good feeling. I can't stop smiling now that I've got him back. You heavy little monkey.
I know, I think he's put on weight. He's done so well. He's really bright this morning. He's really happy. Doesn't seem uncomfortable at all. So,
You're not going to talk to me, are you?
No.
It's all over and done with. Just want to get him home now and cuddles on the sofa tonight, and that's it. Come on, there's a good boy. Going home now, aren't you? Yes, you are. Come on, dear sweetheart. Come on.
I've absolutely loved every minute of my time here in rural Wales.
It's got a lovely temperament.
Yeah, I can tell. That's an experience I haven't had in 17 years.
We'll make a farm vet of you yet, Scott.
The farm vets and nurses have just been so inspiring to work with. The animals, impressive and beautiful. I think I possibly was more nervous than you.
Oh, I don't know. I wouldn't say that.
Hello.
But I think it's been the wonderfully warm and resilient Welsh people and the fantastically beautiful landscapes that have captured my heart and made me think that I could make a go of it as a farm animal vet. But for now, I've got to get back to my family, back to the practices in Richmond, but I know I'll definitely